Intraventricular hemorrhage, or IVH, is one of the most common form of injury in a premature baby in the neonatal ICU. And it's typically thought of as being only occurring in premature infants. However, it can also occur in the fetus before they're born, and also occasionally on term infants. But for the purpose of this conversation, I'm going to keep it to premature infants because it'll be a little bit more straightforward. So we have spinal fluid. It goes around our brain and spine, but it's actually made within the plumbing system of the brain. That plumbing system we call the ventricular system. Within the ventricular system, of which we have 4 in our head, the 2 largest sit in each hemisphere of our brain, and they look like little Star Trek structures, 3-dimensionally. They're very pointy towards the front, pointy towards the back, pointy towards their ear, and they're connected by very thin, short and very narrow, so you're talking about less than 1 millimeter openings, pipes that connect these ventricular systems. So you can imagine how easy it is to get the system clogged at these narrow connecting pipes. But within the ventricles are glands, and these glands, or choroid plexus and germinal matrix, are making spinal fluid. So it's like a swimming pool system, constantly making spinal fluid, and it has to be constantly drained. Imagine if your drain is clogged. That would be a problem. Your swimming pool would overflow. But however, our swimming pool is a closed box, a skull. And inside that skull are 3 things: brain, spinal fluid, and blood. And so anytime you have something affecting the volume of material inside your head, this can also therefore affect your brain. So when you have intraventricular hemorrhage, just like the word implies, intra meaning within, ventricular, within the ventricular system, and then hemorrhage, fancy way of saying blood. We are typically implying germinal matrix hemorrhages when it comes to the premature infant. So the germinal matrix is a structure that in the premature infant, especially prior to 28 weeks, is very fragile. Endothelial cells have a tendency to rupture and bleed with any blood pressure instability. And therefore, think about the conditions under which most premature babies are born. They're born acutely, under stress, where the fetus is under stress, not the mom, but the baby, and therefore they're going to have blood pressure instability. They're in the DR, and what are they doing? They may be doing chest compressions, they're putting tubes in the baby's throats, and all of this is going to affect the blood pressure of the baby and thereby affect the blood pressure the brain is seeing, and therefore rupture these germinal matrix hemorrhages. There is another location that premature babies can get intraventricular hemorrhage other than the germinal matrix, and these are what we call venous hemorrhagic infarctions. We have 2 different forms of blood vessels. Arteries are providing fresh blood from the heart to our brain, and veins are going to be blood vessels draining that consumed blood back to the heart to get reoxygenated. So a venous hemorrhagic infarction means that there is obstruction of blood flow in your venous system, and because these veins are thinner than arteries, are more likely to rupture and therefore result in a hemorrhage. One common location is actually in the thalamus itself, which is part of the walls of the lateral ventricles. And therefore, if you have a rupture in that location, it can very easily bleed out into the ventricles and cause intraventricular hemorrhage. You can also have venous hemorrhagic infarctions in your white matter, the tissue next to your ventricles, and that is again a very sensitive and common location for brain injury in premature infants. So anytime you have bleeding in your brain, because most of the bleeding that can occur within your brain, but not within the ventricular system, but within your brain, are very close to the ventricular system. If that bleed is extensive, it will eventually bleed out into the ventricles. And from our perspective on an ultrasound or MRI, would look exactly like a bleed that started within the ventricles itself, therefore getting the term intraventricular hemorrhage.